Hello students, I am Dr. Saukartika, Assistant Professor, Department of Pediatric and Preventive Dentistry, Vinayaga Mission Sankaracharya Dental College, Salem. Today's topic for discussion is silver diamine fluoride. Let's moving on to the introduction. That knowledge of caries has shifted significantly from a bacterial driven disease process to a biofilm mediated disease process. Traditional approach, surgical approach to caries lesion excision has now been replaced by the rise of a minimally invasive dentistry, which aims to preserve good tooth structure utilizing non-invasive procedures. Silver diamine fluoride had attracted increased contemporary attention due to its efficacy in arresting the progression of dental caries. Various organizations recommended the use of silver diamine fluoride, which includes AAPD guidelines in 2017, ADA guidelines in 2016, IAPD guidelines in 2020. Next comes the composition of silver diamine fluoride. Most commonly used concentration is 38%, which includes silver of about 24 to 28%, ammonium of about 7.5 to 11%, fluoride of about 5 to 6%, which approximately contains about 44,800 parts per million of fluorides and contains deionized water of less than 62.5%. Next, moving on to mechanism of action, fluoride and silver, which is present in the silver diamine fluoride, made soluble in water by addition of the ammonia. The presence of silver bullets, which damages and degrades the bacterial cell wall, disrupts the bacterial DNA synthesis and replication, which disrupts the intercellular metabolic activity, which leading to a cell death. This process of destroying the microorganism is commonly called as zombie effect. And the fluoride present in SDF penetrates deeper into tooth, creating the fluoride reservoir, which contributes to the remineralization and fluorapatite formation, which makes the tooth harder and more caries resistant. The 5% of SDF comprises of about 44,800 ppm of fluoride. SDF, which once applied, leading to the formation of two products, which includes silver phosphate and calcium fluoride. Free silver ions in the lesion demineralized crevices or trace lines are reduced by the environmental oxygen and turns the lesion into a black color, which is the most common major side effect of SDF application. This is a pre and post operative image of the before and after application of silver diamine fluoride, and the common indications for SDF application is, first comes case selection criteria, which includes the pre-cooperative children, that is who are unable to sit in a dental chair for longer treatment periods, and the children with special needs who cannot understand the terms and terminologies of the clinicians, and multiple cavitated lesions which wants to be treated in single visit, and intellectual or the developmental disabilities. Next is immunocompromised patients, where the untreated caries might result in the high risk of systemic infection. Next indication is based on the tooth selection criteria. The tooth should not be with any spontaneous pain and no clinical signs of pulpal inflammation, and cavitated carious lesions, that is which do not invade the pulp, that should be confirmed with the radiographs. Next is the contraindication of silver diamine fluoride application, which includes teeth with pulpitis or pulpal necrosis and deep dentinal caries, because in deep dentinal caries, due to ammonia content and increased pH of SDF, which can create the pulpal reactions, and the peoples with silver allergy. And the next contraindication is oral lesions, which includes, like for example, herpetic gingivostomatitis and ulcerative gingivitis. And the most important thing in SDF is the technique of application. First, we should isolate the area, that is protective covering of the skin, lips and gingiva, either using a cocoa butter or a Vaseline to prevent the blackest discoloration. Next, that is followed by a cotton roll isolation of the particular tooth or that particular area. Next is the removal of the gross debris. Here caries dentin excavation is not required. This step improves the SDF contact with the denatured dentin. Next, 1 drop of SDF liquid is sufficient for the application of 5 to 8 teeth. For the application, it is advisable to use a micro brush. The application time is about 1 minute, and after application, mild air is used to dry that, and the isolation to be maintained for at least 3 minutes. Next comes SMART. SMART is nothing but silver modified atraumatic restorative treatment, which is nothing but GIZ is covered over the SDF treated lesion. You can see the image A shows the cavitated area, and the B shows the application of SDF, and the image C shows the application of GIZ over SDF. Next comes the advantages of SDF is, it is a simple chairside technique which is efficient and effective to arrest the dental caries. It is painless, non-invasive in nature, and it is not expensive, and the less requirement of the personal time and the training, and it also prevents the new caries lesion, and it is highly useful, and it is acts as an alternative option for the uncooperative children. No LA administration is required, and it is a good safety margin with no toxicity has been reported yet. Disadvantages include black staining, which might affect the satisfaction of the parent and the patient, and it causes a metallic taste, and does not restore form and function of the decayed teeth. Gingival and mucosal inflammation might occur, but it might heal in 1 to 2 days of application. It also discolors the skin and the cloths. The commercially available products of SDF in India, it is available as eSDF, Carry Clear, and Keto SDF, and in Japan it is available as Fluoride, and in Argentina it is available as Diamine, and the newer advancement of this SDF is silver diamine fluoride along with the potassium iodide. The reason for adding this potassium iodide is the remaining silver ions reacts with the potassium iodide, which results in the formation of a silver iodide crystals. So there is no free silver ions presence for the plaque precipitate. So we can avoid the plaqueous discoloration by adding this potassium iodide to the silver diamine fluoride. Thus I conclude my topic that SDF is one of the successfully minimally invasive procedure to alleviate the drawbacks and for the better acceptance of the patient as well as the parent. Future advancements in clinical researches are going on. Thank you for watching my class.